Hello, and welcome to Brunel University London, and thank you for joining us today. My name is John. I work for the marketing department at Brunel. I hope you and your family are keeping well during these tricky times. I would like to reassure you that we are operating as normal as possible at Brunel, albeit from a virtual environment for the time being. So I will shortly hand you over to our academic presenter, Dr. Nana Anokye, who will carry out a presentation on the Public Health and Health Promotion MSc, which will give you a complete overview of this course. You'll also have the opportunity to ask course-related questions to our academic today. We also have Ali from our international recruitment team in attendance, so he's able to field any questions you may have regarding the international application process. If you do have any questions today, please type them into the questions box and we will answer them after the presentation. So without further ado, I'll now pass you on to Dr. Nana Anokye, who will carry out a presentation on studying the Public Health and Health Promotion MSc at Brunel University, London.
Thank you very much, John. Good morning, good afternoon, good evening to everybody out there. And I would like to further express my gratitude for joining us, given all the unusual times that we are in. My plan for today is to talk you through or to give you an overview of public health and health promotion, after which I hope to give you an insight as to why choosing Brunel or why studying this course would be such a great idea. And then, as John has indicated afterwards, if you've got any questions, please feel free to ask us. Okay, so to start with, public health, Masters in Public Health and Health Promotion, it's a 1-year full-time course. It could be 2 years, depending on whether you want to do it as part-time. By introduction, as John has said, I'm Nana Anokye. I'm the director of the Division of Health Sciences within the College of Health and Life Sciences. In terms of my background, I've got a PhD in health economics, so by trade, I'm a health economist, but my research area is around public health. So all I look at is to understand why people adopt or take part in interventions and use those methods to inform the cost effectiveness or the value for money for those interventions. Before my PhD, I had a master's in environmental resources management from Brunel University of Technology in Germany, and prior to that, had a first degree in economics and sociology from Kwame Nkrumah University of Science and Technology in Ghana. So the sense of this background is not to tell you about my titles or my qualifications, but to give you an idea that with public health and health promotion, we encourage people from diverse backgrounds. So you might be listening to me, you could be an engineer, you could be, or you could have had a qualification in arts, you could have had a qualification in nursing, you could have been a GP, a doctor, you are welcome. Because with public health, as you might have seen with a recent pandemic, when crises occur or with public health issues, we require different skills from different disciplines. So you are all welcome to this course. When it comes to my external activities, I think the key one is I'm the chair of the International Society of Physical Activity and Health Research Council for Low and Middle Income Countries. And I'm also a member of the African Research Excellence Fund College of Experts. So what is public health and health promotion? As I've said, it's a 1-year full-time course. And in terms of the part-time, starting this September, you could do the part-time in 2 years. We also have an equivalent online program, which follows the same plan or the same pattern as the on-campus program. Now, the slight difference is, whereas with on-campus, you could join in September. For the online, you could join in January, May, or September. So we've got 3 intakes in the year. But in terms of the modules, the content and everything, there is no difference between the on-campus and the online. Obviously, there will be slight differences in the delivery, given the online uses completely virtual mode of delivery. We've got 9 compulsory models, including a research project. And the aim of that research project is to afford students the skill, or to support them learn the skill to empirically investigate a public health and health promotion issue. Now, in doing your research project, which I'll be telling you more about, you realize that we aim to cover all the key aspects of conducting research. And hopefully at the end of that, you'll become an experienced researcher. The aim of the course is to help you develop your research and critical analytical skills. And this will help you become, or support you to become, if you're not already, even if you're a key driver, it will enhance your abilities to be a key driver, a key influencer when it comes to societal change with respect to public health and health promotion. The course will also support you develop the ability to examine the major key determinants of health and ways to promote public health, particularly when it comes to issues of social and economic inequalities. By doing this course, we hope you get to the forefront of implementing, changing, and influencing health policy in whichever context you find yourself. And our aim is to support you to drive changes at multi-levels. So not just at the local level, but transcending it to the national and global levels. In terms of how the on-campus course is taught, for full-time, it's taught primarily within 3 days in a week. And normally, we set our timetable to allow students enough time for self-learning. So it's usually full on Tuesdays, Wednesdays, and Thursdays. And for those doing it on part-time, it's usually on Tuesdays and Wednesdays. Those doing it on part-time is usually on Tuesdays and Thursdays. The mode of delivery uses workshops, team-based learning, and lecture. And we make our sections very interactive because we want the course to be practical. We want you to be equipped with not just the theoretical knowledge, but also the practical know-how, so that when you go out there, you will influence policy change at both the theoretical level and the practical level. Now, coming to the research project, which I gave a brief hint in the previous slide, the research project, I call it the showtime, in the sense that during your research project, which is usually in the 3rd term, it affords you the ability to independently come out with a research topic, obviously under the guidance of an academic staff with key expertise in the area, but it gives you the ability to independently come up with a topic, go out there, collect ethics approval before you do the topic, collect your own data, and collecting your data here could be either primary or secondary data, and then analyze this data. And at the end of it all, given the findings or the results you get from your analysis, to interpret or suggest policy recommendations or research recommendations going forward. So this is a time that all the skills that you've learned, all the models that you've learned during your 1st and 2nd terms, you apply that knowledge into a study that you have set out yourself. And most of the time, from my experience, what we get to find out is that students come out with topics that relate to where they want to be in the future, or if they are already working related to their work, so that the topic choice becomes quite strategic. And with the choice of topics, we have the research methods module that will take you through how to come out with a topic. And on top of that, you will have an academic lead or a supervisor who will be working with you throughout that journey. Now, we've talked about the course content. I know you might be asking yourself that, okay, so when I get all this, assuming I don't have a job, what next? Our plan is that upon completion of this course, you get an all-round knowledge. We know that just having the practical and theoretical knowledge in public health and health promotion is not all sufficient to get you a promotion at your workplace or to get you a new job. Employability skills is a key important aspect. So we have a model, which is a non-credit model, that teaches you or support you to learn the key transferable skills that you need to either gain employment or to progress in your employment. And in addition to this, every spring, we organize a careers event. During that careers event, we invite potential employers all over the sector. So we have potential employers from the health provider section. So in the UK, sometimes we'll have the NHS come in. We have public health professionals. We have professionals from DFID or professionals from other local or international NGOs coming to talk to you and provide you advice as to how you can get a job, or if you're already in employment, how you can progress very effectively. And during this time, I always encourage students to come there with their CVs. And now, just before you come there with the CVs, we've got a consultant, an employment consultant on campus, who upon your commencement of the course will be supporting you. You can arrange meetings with them. They'll be supporting you in filling the gaps in your independent skill, in your transferable skills, or filling the gaps in your CV. So by the time we get to the spring or we get to the annual employability event, you would already have addressed all the gaps you have in your skill set. In terms of the model, so this slide gives you or lists the model. So we have the health economics model, which takes you through how to evaluate interventions. So after you become a public health professional, you're likely to be faced with interventions, which would have been recommended to you, or literature seems to suggest that they are very effective. The key question is, and so what? If they are effective, would they provide value for money? Because that's what the key policymakers are always looking for. So the health economics model will provide you with the know-how to interrogate these matters. Then we have the global public health model, and this model seeks to take you through contemporary issues in the area of global public health. So you'll be taken through all types of disease conditions and how strategies have been put in place to address them. And I presume coming in September, a key topic to be covered here will be the current pandemic. And what are the things that the world or global leaders could have done better, or what they did better? We also have a model on health and society, and that gives it supports you to know the intersection between our society and health issues are sort of facilitated. So how is it that we can promote the health of society by also recognizing issues that are pertinent to society? We have a health promotion model which takes you through behavior change theories and practical know-how as to how you can enact or elicit a behavior change in the local community or context. And then there's epidemiology, which takes you to how to understand disease conditions, how to understand things around prevalence and incidence and whatnot. And then with all this know-how, you will need the information to know how you can communicate with policymakers, becoming aware of the politics of communicating or how policy making works. So through this course, sometimes you may have policymakers coming on to give guest lectures on how health policy is formulated and how you can influence health policy right from the outset. And we have implementing change models. So once you've known about how to develop policy, a key aspect is how do you then, knowing a policy, make the policy work? So with the current pandemic, I know some of the issues going on is how we can all protect ourselves, how we need to wear nose masks, how we need to sanitize. The point is, these are interventions. These are policies. How do we ensure that these policies are well grounded in society? How do we ensure that these policies lead to change? And then at the end, how do we ensure that we can evaluate the impact of these policies? That support or the ability to do that will be through the implementing change in public health and health promotion model. And then the final two models I'd like to talk to you about are the research methods model and the research project. I think I've said enough about the research projects, which you can call your dissertation. But for the research methods model, this is a model which takes you through all the key aspects of doing research. So the first bit is usually around how do you develop a research idea. Then a second aspect will be once you develop a research idea, how do you go about doing your literature review to further affirm or reinforce the gap in knowledge that your research idea encapsulates. Then after, how do you go about collecting ethics approval? Because without ethics, it will be difficult to conduct any research. And at Brunel, we prime ourselves in conducting ethically sound research. Now, after you collected your ethics approval, the next key question, how do you come out with data? There are a number of ways you can go here. It's either you can go for mixed methods, that's where you use a combination of both primary and secondary data, or you can go and use only secondary data, which is data that has already been collected, routine data sets collected, or you can collect your own data. If you're collecting all your own data, how do you go about formulating questionnaire? Or if it's a qualitative study you're conducting, how do you go about structuring your focus groups or your semi-structured interviews to get that required data? And then on top of it all, whilst you've collected that data, how do you go about analyzing that data? Whether it's qualitative data, whether it's quantitative, how do you go about assessing the integrity of that data you've collected, doing all the fancy econometric methods or the statistical analysis, or doing all the fancy thematic analysis or the grounded theory analysis and whatnot. So this is the model that takes you through all these steps. And on top of it all, you then apply this knowledge to conduct your own independent research, which in some settings is a dissertation. Now, so in some cases, you find our students will be asked to write a dissertation between, let's say, 15,000 and 18,000 words. This is something that we used to do, but recently we've realized that if we want to come out with graduates who will be ready to step into positions, then we need to think about how the realities out there are. Now, when you go out there in your respective jobs, usually you'll be expected, if you want to go into academia, the key question is, what is your currency? And by currency, I mean, have you got any publications? We want to support you to get this as part of this course. So what we do is that as part of your research project, instead of writing a 15 to 18,000 word, producing a 15 to 18,000 document, we encourage students to produce a document between with a word count of 3,000 to 5,000 words. And this document should be formulated in a manuscript style, so that upon completion of the dissertation, you have a manuscript ready to be polished and sent to a journal for subsequent review and publication. Now, so you've done public health and health promotion. Where could you find us? If already you are not in a public health career, what are the opportunities out there? What are the future hold? So upon completion of this course, and this is based on experience, this course will prepare you for a range of careers in public health and health promotion, health and social care, the voluntary and government sectors, as well as non-governmental organizations. And we have some of our students, one of our students, for example, is an associate director of public health. We have some of our students, one of our students is a professor in public health. Some of them work as directors of NGOs. Some of them work in the health sector at the front line as public health consultants, the NHS, and some of them work in Ghana as chief physiotherapists and whatnot. So it depends. It's a global village, and we prepare you to fill positions in this global village. I've already mentioned about the annual employability events, so I wouldn't go over it again. But as I said, our graduates usually go into organizational community, strategic development, health information strategies, and project management. And the key point here is that we support graduates to have the skills to step into these positions. Now, why Brunel? The reason you need to come and do public health and health promotion at Brunel is because you come into an institution which is ranked very high in the world. So in the UK, we are ranked 42nd, and the recent Times and Higher Education World University Rankings put us 42nd in the UK, and also within the top 350 1 and 400 universities across the world. In total academic ranking of world universities that was produced in 2019, Brunel was ranked 37th in the UK. And the Times Higher Education World University Rankings ranked us 34th in the world in terms of international outlooks. So when you come to Brunel, right upon stepping on the campus, you see that there's a diverse university. Now, as I'm talking to you now, I'm talking to you from Ghana, which is where I'm originally from. And I know John is based in the UK, so we dotted around the world. Now, we also run 40th worldwide and 9th in the UK in terms of our ability to measure the social and economic impact of universities. So all the work that we do, or particularly our research, is around achieving social and economic impact. And this is what we encourage our students to do. So in your research projects, if I'm likely to lead the research methods model, you hear me constantly reminding you to think about the impact of your work. Because we're not doing research for the sake of it, but we're doing research to make a difference in the lives of society. And that is what we encourage our students to do. We also offer support. We know that we all need help one way or the other. And we do this by offering more than 120 scholarships every year to help international students from over 70 countries. And we also support you to find more about scholarship packages. And the link that you see here is a link on the Brunel website, which gives details about scholarship opportunities dotted around the world. To further remind you about the diversity, so Brunel has over 3,000 international students from more than 110 countries. And here we're talking about countries all over the world. So from Argentina to Zimbabwe. Brunel is a fantastic university. And to let you know, I did my PhD at Brunel and I've not left since. Way back 2009, I've still been at Brunel and I've been progressing. Brunel allows you to be who you are. We promote uniqueness and we promote diversity. International students will have the opportunity to work collaboratively, and we do this not just through the classroom, but we do this by also promoting events. So for example, on the course, we have international lunch, and this is every term, we have international lunch where students all around the world on the course will showcase a traditional food from their country. And it's such a beauty. Now we all meet together, we eat and we discuss and we get to know more about each other's cultures and we learn together as well. So for Brunel, our key objective is celebrating the uniqueness of different cultures. Now, in terms of campus and why we need to choose Brunel, in terms of campus, Brunel, it's just a short distance from Heathrow. So wherever you're coming from, it's just a stone throw from it, roughly about 10 to 15 minutes. The campus is made up of a number of facilities. And the key one for us as public health professionals is that Brunel has a fantastic sports, has a fantastic indoor athletic center, which I'm proud to say that Usain Bolt, during his time, anytime he was in London, he trained at the indoor athletic center. And I had a chance of one day working out with him at the gym. So, and not just Usain, but Linford Christie, who is a celebrated athlete, always is on campus working with other athletes. So in terms of sports, we have an array of facilities to help you get physically active, which is key part of public health and health promotion. In addition, we also have fantastic lecture centers that provide you with the ability to audio record sections, so that after the lecture, if you want to go over and listen to what the lecturer taught you, you can always go over. We also have facilities that provide team-based learning. We have labs, computer labs that will help you do your analysis or where you'll be supported to do your analysis. And we have a fantastic library where it's stocked with the literature that you require for the course. This library obviously it's got a physical location, and in addition, we have a fully equipped electronic side of the library where you have access to all the major electronic databases to get the literature for your research. Accommodation, you might be thinking about that. This gives you a nice overview, or this is a nice picture of the accommodation, the student accommodation on campus. We have over 4,500 self-catering rooms on campus. This includes ensuite, standard, and studio flat options. And you're guaranteed a place if you offer to study, or your offer to study is accepted by 31st August. The tenancy contracts are flexible, and it accounts for vacations as well. In terms of job, for this course health promotion, so yearly we collect data on how our students are faring in terms of work. And over the past 3 years, data shows that we have over 95% of our students getting employed after the course. So I believe that is something that you'll be happy to hear. And how are we able to achieve this? We do this by offering a number of programs on campus. So apart from the annual employability event, we also offer, so I'm a certified coach and mentor myself, but we offer coaching, networking events, as well as mentoring events on campus to prepare you for the job out there. We also offer, in addition to the specific public health and health promotion careers events, the university also runs general careers event for all courses as well. So we prepare our students effectively for the job market out there. So this tells you, that's the end of the content about why you need to come to Brunel and why you need to study public health and health promotion. Now, I believe you have questions that you have the chance of asking, but in addition, you might want to find out more about us. And if you want to find out more about Brunel, you can connect with us either on Instagram, Snapchat, Facebook, or Twitter. And what you see on the slide are the ways that you can connect to us.
Fantastic.
So over to you for questions.
Fantastic. Thank you very much for that presentation, Dr. Anokye. Rather than myself heaping praise on you, I'd just like to add something which our attendee said. Somebody found the presentation powerful and motivating, so very high praise indeed. Thank you for that. Okay, so as Dr. Anokye said, I will now open the field for questions. So if you do have any questions, we can't take them verbally, unfortunately, so you just need to type them into the question box, which you should be able to see on your screen. Just a reminder as well, my name's John. I work in the marketing department, so I'll support questions where necessary. But obviously, I'm assuming a lot of your questions will be for our academic, Dr. Anokye. But we also have a representative, Ali, from the international recruitment team. So he'll be able to answer any questions you may have regarding the international application process. So let's start the show then. We've got a couple of questions coming in. Just to let you know as well, for the sake of privacy, I won't reveal the names of who's asking the questions. I'll just ask the questions that come through. Okay, so we have our first one here. In your presentation, Dr. Anokye, you indicated that full-time studies is 3 days per week. My question is, how many hours and modules are covered within that day? That's for you, sorry, Dr. Anokye.
Thank you very much. So usually we break our models into 2 terms. Now we've just had a modification, so the timetable is not out. So what I'm coming to tell you is provisional. But what you're likely to face, or what we plan to do this year, subject to confirmation, is to have 4 models running in the first term and 2 models 4 other models running in the second term, so that you have the chance to do your dissertation for the whole of the 3rd term, so you vacate.
Okay, excellent. Next question, which is a bit similar. How many students on average are enrolled into the Public Health and Health Promotion MSc?
Okay, using the last 2 years at my sample, I would say we're looking at an average of between 33 and 35 students.
Okay. Another question. Oh, very, very topical question, actually. So this is a good one for you, Nana. Please update us about your preparedness towards international students during the COVID-19 era.
Okay, so during this era, we've been very much conscious about, for example, for international students who are based on campus. So we have some of our students currently on campus. The question is, we're very much aware that these are students who don't have immediate family members in the UK. So what we've done is we've offered some of these students the ability to either stay on campus or travel to their respective countries. Now, for those still remaining on campus, then we have personal tutors. So every student on this course will have a personal tutor. Now, the personal tutor, in addition to your lectures, is to offer you pastoral care. The personal tutor engages with the students once every week, and this is what we've got on paper. In addition to that, students could get in touch with the personal tutor at any time to arrange a meeting and discuss or go through some of the issues that they are having. Now, quite apart from that, too, we've created a number of peer support platforms. So we've got a Facebook where students go and interact, and we also got a WhatsApp account, and that's where students go and interact freely among themselves. And I always say this, public health and health promotion, you hear this often when you come on this course. We don't call this a course, we call this a family. So the student body full of international students, the staff body full of international. So I'm the course leader, and I've told you when you look at my background, I'm originally from Ghana, traveled to Germany, and did my PhD in UK. We have some of our staff members from Nepal, some from the UK, some from the US, some from China, some from Netherlands, and all that. So it's a fairly international body, both staff and students.
Fantastic. That's actually a very, very good point. And just to reiterate that, we have not only a strong community amongst our students, but the academics as well. You really will feel like, as Dr. Anokye put it, part of the family when you do join us. So during this era, we will, of course, listen to every individual concern that comes up, and we'll try our best to overcome those.
John, can I also add some further details around that? Obviously, you know, our respective academics are also trying to prepare, you know, the best that we can in terms of offering the courses to our students. But at the high level, the university is well prepared. We're working closely with the NHS and closely monitoring the latest advice to ensure a best practice response to limit the risk of further spread. Also, I can say that the senior leadership team at the university are regularly meeting to ensure that we have appropriate plans in place. Staff and students receive updates via email and on the staff and student intranets. And obviously, you know, as you're all here, we have and will be holding a number of webinars in order to share information and answer specific questions as they're asked.
Fantastic. Thank you for that, Ali. Actually, Ali, while we have your attention, there's an international question come up that you may be able to help us with. A student has said they require a Tier 4 visa to come and study in London. Will I be able to start the course in September itself? And they mean the campus course in September.
Yes, for now, what we can say is the university is open for the September intake. We're expecting to start term 1 on the 21st of September. So we're still going ahead with that plan. We're quite optimistic, obviously, in making that decision. But I should also add that the university is looking to develop quite a flexible approach for our programs. As you know, Dr. Nana's mentioned a number of models in terms of how the course can be taught and delivered. There's the online model for those students that are interested in that model, but then there's also the alternative models. But just generally speaking, we're looking to develop a dual delivery approach for our programs. What does that mean? It means that our programs will run in parallel tracks online and on campus, and students will be able to move between the 2 tracks depending on travel or lockdown restrictions. Each track will be taught to the same high standard and will be fully supported. We're aiming to take this approach for all programs, but obviously there may be some exceptions where it's not possible to teach online. What does this also mean? You know, I hope that our audience can appreciate that this means that as a university, we need to reorganize some elements of practical teaching to better you know, meet the needs of the students. We're also looking in some cases to introduce a January start. So again, just some general comments, you know, on all courses and not just this particular course. Yeah, we'll be looking to support our new students who may have been out of education for some time with a return to learning program to ease them back into studies. In fact, John, you might want to also mention the postgraduate gateway program, which I believe is going to be an 8 or 12-week preparatory course available free of charge to all postgraduate offer holders for the coming intake. And it's really sort of designed to, you know, just obviously offer you, you know, our international students an opportunity to engage with us, but equally for the students to understand some of the technologies that we'll be using. So in that sense, it'll be also a little bit of a taster. And last but not least, I should also say it's an opportunity for students to network with other international students before they arrive on campus. So all in all, a really attractive package. And the last thing, I think I can add to all of that is that we're ensuring that our campus is a safe place to study and live. It's one of the advantages of living or offering a campus experience to our students is that it has a boundary and we can control how we manage our facilities. So we've got some excellent amenities on campus, and we will be have been establishing protocols for building use, hygiene, and social distancing. So these plans are being developed on a program by program basis. Dr. Nana, I think, alluded to some of the specifics for his respective course. This is obviously done in consultation with staff and students. And we'll share more as they're confirmed, and hope to come back to you all with further details and confirmations in the coming weeks. Yes.
Okay, and sorry, John, if I could add something. Thank you very much, Lee. So it might interest you to also know that Public Health and Health Promotion is the first program to have an online version at Brunel. So what that means is during this time, given the issues about social distancing and other protocols, that calls for being flexible enough to promote remote teaching and support. So we are far ahead because we've already gone through that process. And as Ali alluded to, the meetings we have, and I would say that you are in safe hands because you already have the mechanisms and the tools in place for this course. So in COVID, I would say we do our best to make sure you are covered. Thank you.
Fantastic, Dr. Nana Anokye. And I think that's absolutely spot on, really. Public Health and Health Promotion has a very, very strong online teaching history. So that, like Dr. Anokye says, is pretty much covered in that respect if we have to conduct some of the teaching online. Just to go back to some of Ali's feedback, I think he's described the program we're running very well, which is the Postgrad Gateway program. So this is a program for postgraduate students that takes place every Wednesday for just 2 hours between 11 a.m. to 1 p.m. British Standard Time. So it's a series of live online interactive discussions that helps you develop your study skills and really prepare you for university as a postgraduate student. There's also a series of English language lessons for our international students. So if you want to kind of, improve or develop your academic English, it's a good opportunity to do so. And of course, it is free. So in terms of how you register for this Postgrad Gateway program, quite easy. You just go to our website, which is www.brunel.ac.uk. Just repeat that again. It's www.brunel.ac.uk. And if you scroll down a little bit on the page, you'll see a big button that says Postgrad Gateway. Click on it, check out some more information, and you'll also be able to register for the sessions themselves. Just while we're on the topic of COVID-19 as well, I would like to reassure you that this is a continuously developing situation, but Brunel is keeping pace as much as possible. So again, on our website, which I mentioned a second ago, www.brunel.ac.uk, right at the top, there's a very detailed COVID-19 question and answer section. So if you have any questions related, I'm pretty sure it should be covered there, but if it isn't, you're more than welcome to email and ask us. Okay, so just to go back to the question then regarding the webinar that just took place, sorry, we do have a few more questions that have come in. So I'll go back to Dr. Anokye. After completing the course, what will be the job opportunities?
Okay, so as I mentioned earlier, the job opportunities using our students, our alumni as a case study runs from working in international NGOs, local NGOs, working in the health sector, working in academia. So as an example, the current external examiner of the course, it's an alumna. So he's a professor in public health. So that's a success story in academia. We also have some of our students working as directors of public health organizations, some working as consultant midwife, some working at physiotherapists, and these opportunities or areas I'm talking about are dotted around the world. So public health, and using myself as an example, I'm a health economics, having an economics background, and here I might have a career in public health. So the course provides you with the flexibility to jump into several areas that you want. And I need to emphasize that we don't leave our students to struggle and get this opportunity. We support you. So once you start the course, you will be getting lots of emails of staff members about opportunities even before you finish. And also you have a consultant employability officer on campus that will be helping you go through addressing the gaps in your CV, the employability event and all whatnot. But we just don't tell you, it's not about show and tell. We try using coaching techniques to find out what exactly do you want to do? And then we can support you get those opportunities. To top it all, as I told you, we have over 95% employability or success rate when it comes to employment. So our students upon graduation, we tend to have about 95% of them getting jobs.
Fantastic, thank you for that. So while we're on the topic of employability and the future after you graduate the course, what is the average salary package you can look out for after completing the MSc? Over to you, Dr. Anokye.
Yeah, that's a tricky one in the sense that it depends on, as you could see, there are variations when it comes to salary. For example, if you're working in academia, I would say you are looking at, assuming you're working in the UK in academia, upon completion of public health. So let's say you're employed as a research assistant, then you're looking at something roughly around 30K thereabouts. If you go into an international organization, let's say you land a job with the WHO, it becomes a different ball game altogether. It's a bit higher. If you're working in the public service too, it's a bit higher. So I would say it depends. But given the job areas I've talked about, on average, public health promotion offer a good size of income or salary.
Fantastic. And of course, based on the current situation, what we're experiencing with COVID-19 is, I'm assuming, a very employable area. There's a lot of demand for people in the promotion of public health. Is that correct, Dr. Nana?
Yes. And actually, part of the key objectives of the university, as well as the government, is to, support our role or our support to the COVID is to provide more opportunities or to support the health sector. And actually, we have some students during this time. We have some of our students, postgraduate students in the division. One of them created a toolkit that was to support decision making related to COVID by a health authority in the UK. And in Ghana, we have one of our students supporting the public health education for COVID. So as John has said, if there is a time to do public health, this is the time.
Fantastic. Okay, we have a lot more questions, so I'll try and speed through a few of them. The next one is somebody's asking about the duration of the course. They're asking if there's a part-time version that's covered over 3 years. Is this correct? As in the presentation, it said 2 years. Sorry, that's for you, Dr. Anokye. I think you might be on mute.
Yeah, sorry, I was muted. Yeah,
no problem.
I'm saying that currently, so previously, the last academic year we had, and you might even see on the website, we had a part-time version running over 3 years. But we listen to our students. We are listening course team, and the concerns we have from our students was that 3 years was a bit far, a bit too long, and they wanted to complete within 2 years. So now we've offered that flexibility. There are students who complete a part-time course in 2 years. So for now, part-time is 2 years and full-time is 1 year.
Fantastic, thank you. Next question is, you mentioned compulsory modules. Are there any optional modules?
No, our modules are compulsory.
Fantastic, thank you. Next question. In the global public health module, what are the practical avenues in place to really experience global health? That's a very good question. Yes.
Yeah. So there are our course. I'd like you to see our models are not standalone. So the course was developed to have all the modules interlinked. So in global public health, you will have the sections of the support on the key global health issues. Now, this knowledge is expected to be put to good practical use in the health promotion section, where, for example, if a topic that has been covered in global public health is around COVID, the next question is, how do you come out with interventions to address the COVID issue? You do this through health promotion, where you have practical sections or practical know-how on how to set up interventions to address public health issues. And not only that, how to evaluate these interventions for their effectiveness and also their cost effectiveness, which is done through a practical section in health economics. Now, on top of this all, as part of the course, you might then choose a topic of interest. And this topic will be a topic that you've learned or you've got interested in through global public health. So for example, if you want to investigate or explore some of the ways or some of the determinant factors of COVID or getting the virus, or what are some of the key risk factors, so that going forward, we can make sure that those people are protected, you do this through your dissertation. And that will help you collect data out there to practically address the issue that you learn through global public health, the issue that you learn through health promotion, and the issue that you learn through health economics, to mention a few.
Fantastic. So the next question is just a repeat, really. Can you mention the entry requirements for the course again, please?
Yeah, so the entry requirements, we're looking for area irrespective. So as I said, we want to encourage a diverse student body, and not just in terms of origin, I mean country, but also or culture, but also in terms of disciplines. So as I said, you could be an engineer, you could be a social scientist, you could your area could be in arts or pure science. You are welcome. But for the grade point, we're looking for at least a 2.2. A 2.2, which in some areas you call it a second class lower to get onto the course. Now, in case you haven't achieved the 2.2, but you have a degree, we will then look or expect you to have a minimum of 2 years relevant work experience. On top of that, if you don't have, so that is for the other route is that if you don't have a degree, but you have, let's say, a higher diploma or you have a diploma, then we expect you to have a minimum of 5 years relevant work experience. So I would say we look at application on case-by-case basis by using these guidelines.
Fantastic. Thank you, Dr. Anokye. I'll field the next question. Somebody's asked for the accommodation cost. So if you Google accommodation section, which is basically go to Google and Google Brunel accommodation, you'll see a very detailed overview of the types of accommodation available and the cost. But just to give you an indication of how much it is, accommodation on the very most standard of facilities start from £435 per month. I'll repeat that, that's £435 a month, which I can assure you for a London rental cost is very good. So that's the accommodation question. But if you do have any additional ones, please, again, Google Brunel accommodation and you'll find a lot of detailed information there. Right. So just going back to the international application process, what happens if, as a result of COVID, international students have difficulty in accessing visas? I think that might be more for you, Ali.
Yes, John, so if I can just repeat the question, what will happen if students are unable to get a visa? I think obviously our admissions team, I think the first thing I'd like to say is we are looking to provide as much flexibility as we can, both in terms of, eligibility requirements, but also in terms of time delays by way of delayed examinations or exam boards or terms, for instance, taken by international students abroad. So if for any reason we're unable or the student is unable to apply for the visa or indeed come to the university on time, then that's number one. That's where the dual delivery program approach I mentioned previously comes into play, in that students can continue their studies online and then try and join us when they can at a later stage. So again, more information will become available on that particular model in the coming weeks. But the other thing I'd also like to mention is if a student has paid a deposit, towards their tuition fees, and if for whatever reason the student is unable to come and they would, then they're not interested in deferring their start date to the following intake, then we will offer a full refund. So these questions, along with many other important questions, you can get, written answers to through our coronavirus information hub. If you visit our website, that's brunel.ac.uk, and on that front page, you should be able to find a link to the coronavirus information hub, and click on the prospective students tab, and that should take you to the specific page where you'll find a number of questions and the answers that we've prepared. Just to add a note, as the situation is quite dynamic and it is changing, and obviously whilst we are optimistic, some of the answers may change in the coming weeks. So keep an eye on that page, and there should be more questions answered and some of the answers refined as we move closer to September.
Thank you, Ali. It is indeed a very fast-moving situation. So while I have your attention, Ali, actually, the next few questions are related to the international application process. So the next question is regarding scholarships. Somebody has applied for the Commonwealth Shared Scholarship. Can you please give an update on the nomination for the scholarship?
Yes, as far as I'm aware, I think the Commonwealth Shared Scholarship allocation should have been completed. It's a process that's led by our scholarships team. I believe also alumni team are involved, as well as the academics for the respective subject areas. So if you haven't received a response, apologies first and foremost. What I would suggest is if you sent an email to our scholarships office, that's scholarships@brunel.ac.uk. So that's scholarships@brunel.ac.uk, to find out the status of your scholarship application. They will come back to you as soon as possible. John, I think you're on mute.
Sorry about that. Thank you for pointing it out, Ali. The next question is related to scholarships again, and is asking what type of scholarships are there available at Brunel. So what I'll actually do is take this opportunity to bring up a slide again. Hopefully you can see it from the current slide. Oh no, just bear with me 1 second. Here we go. Can I go back? Here we go. So somebody asked a question, what type of scholarships are there available at Brunel? Just to confirm what Dr. Anokye said earlier, there are over 120 scholarships available. And if you just make note of that link, you can see on your screen right now, that will give you detail of all the types of scholarships available, as well as really useful eligibility information towards that. Is there anything you want to add to that, Ali?
No, I think that, as you said, there are plenty of scholarship/bursary fee incentives that we offer to international students. So too many to mention, in fact. So yes, I think that link is probably the best source. You can click on the link and you can apply some of the filters to identify the types of scholarships most relevant to yourselves. Yeah.
Fantastic. Sorry, Ali, I got another one for you there. Just bear with me 1 second. Sorry, just trying to find it. I'm sorry, I do apologize. Sorry, we're having a slight technical issue where I can't seem to see the question. Oh no, I think it's actually gone. There's no further questions. So we still have a few minutes left of this webinar. So if you do want to get in those last minute questions for either our academic, Dr. Anokye, or our representative from the international recruitment team, Ali, please do so, and we'll try and answer them for you. So we'll just stay on hold for the time being. Actually, here we go. One's just come in now, and this one is for our academic, Dr. Anokye. Okay, so there's a couple of questions here, so I'll try and be as clear as I can. Here we go. Assessment. How many exams are there? And how does the course work? Oh, sorry, let me read that again. I'll rephrase it. How many coursework is there within the modules? So can you please specify the assessments for each module? Sorry, a bit of a complicated one. Hope you got that, Dr. Okay?
Yeah, so for the modules, and I think as Ali has indicated, we are in unusual times, and we're going through a lot of discussions to ensure that we offer assessments that will be flexible enough given what happens. So if suddenly midterm we realize that there's going to be another lockdown, then obviously the students, the assessment is flexible. So at the moment, we incline towards providing coursework submissions, and all these submissions are done online. Now, if there is going to be an exams, it's going to be online as well. And here we're talking about multiple choice as well as short answers. Now, so taking you through the coursework. So for example, let's take the case of our research methods as an example. A potential coursework to be for you to develop a research proposal. And in the research proposal, we expect you to talk through or justify the rationale for the topic that you've chosen. Obviously, a relevant public health issue, and then also talk us through the policy architect around that question. And in the introduction, also tell us about the research gap. So why it could be an important topic or research area, but why is it that this topic has to be studied? Is it addressing or contributing to the literature? Now, that's for the introduction. In the methods, we expect you to tell us clearly how you're going to get your ethics approval, how you're going to collect data, how you're going to analyze, and how you're going to sample if you're going for primary data. If you're going to use secondary data, where are you going to get that data from? And then finally, give us an idea about what are the policy areas or the recommendations your work or the benefits your work is likely to give to policy. So this will be a typical assignment for research methods. There are other assignments, for example, implementing change. It could be something like a case study where you need to talk us through, or a poster where you present quite clearly how a public health issue is addressed using a particular intervention, what to be the extent, the nature of that intervention, and how could that intervention be evaluated. So the simple answer is that we're planning to go for this, for this year, to go for online submissions to minimize the impact of any shock that we may have going forward. Hello, John.
Sorry, Dr. Okay. I'll just say, now that we quickly have your attention, could you let us know how a student would decide their dissertation topic?
Yes, the students will, they will decide the dissertation topic after being supported into, normally we look at 2 or 3 sections where there will be topics around how to develop a research idea. And those topics are normally taught as part of the research methods. So there will be 2 modes. It's either you can get a dissertation topic, for example, which should be an extension of your undergrad dissertation, if it's in a relevant area. It could be related to a topical area going on. I would not be surprised if this year many students decide to do things related to COVID. It could be related to, if you are already working, it's related to your work area or your job. But all, as I said, you'll be supported through the research methods to come out with the topic. So we expect to allow students ample time to work towards their dissertations. We expect that at getting to the end of the first term, students will then submit their research proposal. And that research proposal will clearly lay out or lay down the topic they want to work on. And after submission of that, this will obviously be marked and they will be given a dissertation supervisor who will be working from them right from that time till they complete the course the following September. So we just don't allow you to, not that we don't allow, I think for want of a better word, we support you not just in the third term, but right from the first term to get a dissertation topic and to support you throughout to implement that topic.
Excellent, thank you very much. A couple of international questions coming in, so we'll just bring Ali back in. So I would like to know when the university will be issuing out CAS to international students.
Yes, so typically the university would start issuing CASs 3 months in advance of the intake. So this year, as the start date is the 21st of September, then it would be 3 months prior to that date. So that would be what, June-ish, late June even, I would say. That's when the university would look to start issuing CASs. But obviously, you know, our admissions office will be, you know, aware of any developments or changes to the visa process, and will be advising our offer holders directly via email if there are any sort of such changes. But yes, tentatively, late June is when we will start issuing CASs for the coming intake.
Thank you, Ali. This one may also be for you. How do we go about the English proficiency requirements as test centers are not in operation during this pandemic?
Yes, what I would suggest is to send an inquiry to our admissions office, which is international-admissions@brunel.ac.uk. That's international-admissions@brunel.ac.uk. So we have a dedicated language center on the campus, and they offer a number of options in terms of testing for English proficiency. But to get the full list of options, because that list of options is changing almost every other week, I would suggest to get in touch with the admissions office, who will then liaise with the language center and advise you on the most accurate way of you know, testing your English proficiency, obviously in light of IELTS test centers being closed in country.
Fantastic, Ali. And I'm not sure if it's been mentioned, but just to reiterate, the admissions email address, if you need to contact them, is quite simply admissions@brunel.ac.uk. Again, that's admissions@brunel.ac.uk. Right, now I realize we are overrunning by a couple of minutes, so we'll field our final 2 questions of the day, which should hopefully cover everything. And then we'll see how it goes from there. So one of a nice question that's come in: is there any recommended reading prior to starting this course? And that's for our academic, of course.
Yeah. The reading I recommend is, so I don't like recommending textbooks, but what I recommend you read around is getting, for this course, to do very well on this course, I think your academic skills, i.e. your scientific skills, ought to be good. So for a start, I suggest you read things about, read journal papers. Let's say, so for example, you could read papers in the Journal of Public Health, Journal of Public Health papers. Now, the benefit of doing that is it helps you to know the right, because you may have fantastic ideas, but at a master's level, we expect you to present your ideas in a critical way. So you present both the pros and cons of ideas, you justify your arguments using the literature. So once you read the articles in Journal of Public Health or Journal American Preventive Medicine, or the public health type journals, you will know how the arguments are structured. And in addition, it also helps you get deeper understanding of public health issues. And strategically, you will then be identifying the gaps in the literature. And this will inform your choice of a dissertation topic.
Okay, fantastic. While I have your attention, Dr. Anokye, somebody's asked, what is the minimum credit hours to qualify a student for graduation, so to complete the degree?
Okay, so for the degree, we are looking at 120 or 180 credit hours. So for the course, for the modules, is 120, and for the dissertation, 60 credit hours. So overall, 180.
Alrighty, thank you very much. One question which I think I can actually field. Somebody's asked if registration on campus will happen during the week commencing the 14th of September. As far as I'm aware, and I'm sure my colleagues can correct me if I'm incorrect, is we are adhering to the latest government advice at the moment. So whether or not that happens, on campus registration happens on the 14th of September, it's too early a stage for us to tell at the moment. But when we find out a bit more close to the date, we will let you know. And of course, if we can't do it on campus, we will endeavor to do it online for you. I think that about covers it, doesn't it, Ali, in terms of registration?
Yes, John. I think that advice is fair and it's up to date. But again, I think it's just letting our audience know that the information will change in the coming weeks. And in the meantime, please visit the Brunel website, specifically the Coronavirus Information Hub, to keep up to date on the most up-to-date, I guess, information, but also the university's decision on the coming intake.
Fantastic. Okay, so we'll have our last question of the day, which I'll forward on to our academic, Dr. Nana Anokye. Do students get their certificates immediately after completion of the course?
Yeah, immediately is quite subjective, but I think my answer will be students, you don't need to come to the graduation to get your certificate. So once upon completion of the course, usually all things being right, your final module to be assessed is the dissertation or the research project. Once that is assessed, you usually submit that around September. It goes through an exams panel, goes through an exams board, which is usually around November. And for people in the course, we expect that at the end of the exams board, which is usually in November, you should have access to your transcripts and then your certificates. But actually, right after November, then you have your graduation in September. You have your graduation in December. So it's not that far away if you want to wait till graduation to get your certificates.
Very good. I think that now covers all the questions today, and it's a very, very good range of questions. So that gives you a nice, good overview of what studying the Public Health and Health Promotion MSc at Brunel is about. So if you do have any further questions, please don't hesitate to contact our admissions department. We mentioned the email address a few times today, but again, it's admissions@brunel.ac.uk. And of course, again, we'd like to promote our website, which is at brunel.ac.uk. Again, that's brunel.ac.uk, which has a very, very detailed hub regarding COVID-19 and what the present state of play is, so to speak. So if you just go on there, you'll find plenty of information. So I'll just give Nana and Ali the opportunity to say goodbye.
Okay. Thank you very much, and see you soon. We're welcome you to be part of the family. Thank you.
Likewise, thank you, everyone. Thanks for joining us. It was really informative. Thank you, Dr. Nana. Thank you, John, for organizing this. And thank you all for tuning in, and hopefully see you all very soon. Thank you.
Thank you all very much. And I would like to just say, I haven't read out all the positive stuff you're saying, but a lot of you are sending really, really positive messages regarding the presentation. And I'm pretty sure, I'm not sure, I'm certain, I will be forwarding them on to Dr. Anokye and Ali after the presentation, so they can see your feedback. So just to reiterate what my colleague said, please continue to take care of yourselves, and hopefully we'll be seeing you very soon at Brunel. Goodbye.